Well, hey everyone. Sorry, I went live a little before I was ready, in order to make it between the when the song started and the last song ended and the next one started. Hello, guys. It's Christy. It is Sunday, so hello and happy Sunday to you wherever it is you are and whenever it is you are. It might be morning, might be afternoon. I don't know, but whatever it is, I hope it's a good one. Yes. So, um, let's just be honest. This show is going to probably be pretty short compared to my other ones. Normally, I would be reacting to news or other things. Honestly, it just feels like this isn't the time for me to be, hello, lucky wanderer. This doesn't feel like a good time for me to be bashing Bernie Sanders. I do wish he would get out of the race so that he could focus on his Senate work, and Joe Biden can focus on being the presumptive nominee. But it just feels to me at this time not an appropriate time to be focusing on that. The only thing I will say is on that issue. Let me switch here to my other screen. Bam! Look at that go. There is a New York Times piece that I want to read. New York Times, as you know, has a number free limit and free article limit. Wording is hard today, and they have done a analysis of the Bernie Sanders campaign that I do want to look at. This one here, how it all came apart for Bernie Sanders. I'm not going to do that on the air though, right? It's just that's so in terms of like news and do politics stuff. The big thing in the Democratic Party, if you want to drop below the sort of public health, economic crisis, everything else, and go just pure politics. The issue now really is, when does Bernie get out? How does he get out? And that's really it. So I don't really know that there's, like I said, much value in going over that article in detail here on the show. You should feel free to use your one free article and look at it. I might do that and like screenshot bits of it and look at it in another show, but I kind of get a bad taste in my mouth when people are out there undermining Joe Biden. Like beyond sort of like the whole dementia slur and just Russian propaganda, that kind of, I understand when people should get feedback or suggestions, but I just want to, yeah. So that being said, I'm not going to go over this New York Times article. I just want to make you guys aware of it. What I thought I would just spend a little bit more time doing is kind of a personal vlog. I want to talk a bit more about what it's like for me. We're not really in lockdown, and actually I was going to check that as well, because Germany, Merkel had sort of threatened Germany COVID-19. Yes, you can see I've been doing some analysis, what the current status is, because Angela Merkel said that she was going to do more of a crackdown over the weekend if people didn't sort themselves out and stay in their homes. And it's been a lot quieter. I know that the cops, people were going into the parks and just doing like little clusters of families, and the police had to come by and be like, you guys, I know it's a nice day out, it's one of the first days above 50 degrees Fahrenheit, or what is that, like 10 degrees, 20, 50, yeah, like 10 degrees Celsius, but you gotta go home. I was still seeing people walk around a lot more, and Sunday also is when the shops are generally closed, but it is becoming more and more like a ghost town. Cologne, which has more than 1,000 people, more than almost 1 million people. Sorry, I was just looking at these numbers, about 10,000, and I had yeah, so I want to talk about Germany, and then I'll switch to the US. JMM, Trump has done way worse than Biden when it comes to the pandemic. Yeah, honestly, we can talk a little bit about that. I know Biden's going to start doing some things from Monday. I don't really know what effect or how efficacious that's going to be, but so speaking from firsthand experience, it doesn't seem like Germany lockdown, see if they had an update. see if I have okay. Let's see, partial lockdown. So I have to check. I live in North Rhine-Westphalia, and I know in the areas in the south, closer to like the Italian border, that area, closer to France, they've had more cases and therefore more of a shutdown. So let's see. Once busy public spaces fall quiet on Saturday as the number of states imposed quarantine measures that call on all people to stay home. The Western state authorities have indicated the public response to social distancing measures on Saturday will be key in determining how to proceed with further restrictions in Germany. We will look at the behavior of the population this weekend. Let's see. It doesn't seem... Merkel is due to meet with state premiers on Sunday to decide whether a lockdown should be instituted at a national level. Authorities in Germany are scrambling to curb the coronavirus pandemic. The country has reported more than 20,000 infections of the virus on Saturday with 70 deaths, so that's doubled since just a couple days ago. However, it is worth noting on the German data, we have more tests. Here in Germany, there's been more testing, but the population that apparently had and is, initially contracted and spread coronavirus was a much younger demographic. Italy is a pretty old country in terms of its median age. I think its median age is 46, and it has quite a number of elderly people. And as we know, those are the most vulnerable in terms of the population for mortality when contracting COVID-19. In the German population, the people who brought it back from Italy brought it back from a skiing holiday. So one of the analysis that I read mentioned that it's kind of like which population in Germany caught it and transmitted it helped to keep the fatality cases low, because people under the age of 45, which is younger than me, but people who are under the age of 45 have a really high recovery rate. And if they're spreading it within their cohorts, initially we're not going to see so many deaths. If you look at what happened in the States, for instance, you had people on cruise ships, and who goes on cruise ships? Elderly people. I'm sorry, I've been on cruise ships. I've been on one cruise my entire life. I was actually planning on doing an Alaskan cruise in August with my dad and a friend. We're going to go out on an Alaskan cruise. That has obviously been canceled. But that's the population who is most at risk. And then when the elderly people got off the ships, or the people who were with their elderly family, whatever, spreading it inside elderly residence homes, that's where I think a big section of the Bavarian cases here in Germany were deaths associated with people living in retirement homes or retirement communities. I'm going to come on to the UK's response because I am terrified. I'm absolutely terrified of what's going to happen in the UK. So a lot of thoughts in my head. So from a personal level, I don't think I took this as seriously as I was slow to realize it. And I've given credit to him before. V was in my DMs like a month and a half ago telling me to stock up on hand sanitizer and toilet paper, and I pretty much blew him off. And I'm actually glad I did, because I didn't want to contribute to the panic buying. The supply chains are fine, and it doesn't help to promote that kind of panic. By the way, I'm totally looks wise, I am so overdue for a haircut, and I hope I'm gonna go with my bebop look here. I'm really hoping that we don't go on a full lockdown, because I have a hair appointment for Tuesday, and these babies need to be cut. So hopefully next time you see me, it'll be about that much shorter. But in the meantime, I'm rocking the whole stay-at-home looking like crap look. But coming back to it, so yes, the German population had a lot of structural advantages, and also just luck on the population that contracted it. So they were lucky in that they saw what was happening in Italy and learned from the mistakes and were able to respond. Maybe not in the perfect amount of time, but certainly they didn't have the delays the UK did, and they didn't have the denialism that the that the Trump administration did. So they were already better suited in terms of bed capacity. They already have a good sick leave system. So when people get sick, they can stay home and they won't spread it, and they don't have to worry about going to work and earning money. So there was also I learned there was a bill passed in after the crisis in 2008 from Germany. Do my own hair? I can't. I'm not even going to try to. I will cut my own hair. I will try to cut my own hair if I can't get to the hairdressers. But did I say hand sanitizers? God, I'm a little bit, hand sanitizers. Man, I have to practice wording. This is the first time I've talked today. It was when I got on air with you guys, so my wording might be kind of silly. Sand sanitizers. That just, it sounds like, I don't know, some kind of Star Wars thing. All right, I keep looking at the chat and getting distracted. Sick leave. They had a 2008 post-financial crisis bill that allows employees to reduce their own hours. And I don't know if my employer is going to ask us to do that at some point, but it allows you to kind of like go down to a certain percentage, but still keep your job and get some kind of subsidy. I don't really know. And so between healthcare coverage, sick leave coverage, this other scheme, and there was a lot of structural things, and also just getting lucky in terms of the population that contracted it. Germany's, I think, been relatively lucky and well managed. So it's a combination of things. And I know that they are also making a lot of efforts now to ramp up more healthcare. That is all on the abstract level. Let me talk a little bit more about the personal level, if I can, confide in you guys a bit. I've been pretty stressed out, honestly. There's a couple things in particular that have been a source of real stress for me. First is I don't necessarily, so I'm kind of like resigned to the fact I might end up with coronavirus. I'm probably not in a population that's going to end up hospitalized if I do get exposed. However, yeah, thank you, Ramona. Yeah, the number of times my first words of the day sound weird. I didn't do my hip hop warm up. Normally I do some Eminem songs to warm up, but today I was just kind of scatterbrained. So yes, and the idea, so if I do get it, I'm planning on staying home. I'm not going to bother if I get any kind of illness, unless I feel like I can't breathe. I'm just going to stay home and self-isolate because I don't see the point of getting tested if all I'm going to do is expose more people to it. And yeah, I can add to the data, but there's not really any point. If I were to get, have some sort of bad case and needing to be in the hospital, what stresses me out there is that my German isn't very good. I'm an immigrant, and I can speak some, German. I don't know medical terms. I don't know how to describe necessarily how I'm feeling. And yeah, quite a lot of hospital staff people here speak English, but it's kind of a scary thought to think that if I'm in a compromised health state, I'm already struggling maybe, for breath, and then to try to remember how to conjugate verbs, like no. so that is stressful for me. And I do have some friends I can call on, but I don't live with anyone. I don't have any pets. My friends in town are also self-isolating, and they're in different parts of the city. There are several people I could call on, and several people who'd be mad at me if I don't call on them. But it's still a source of anxiety. The other major source of anxiety for me is just the being physically cut off from the States now. It's one of the ways I've coped with living away from all of my family is to reassure myself I'm only one flight away. I can always just, if something were to happen, it would be expensive, but I have a credit card in reserve I could use if necessary, and I could book a flight and I could get back home. And I just don't know. I'm completely cut off from my family. Or I could probably get back to the States. I could be just on, it might be difficult to find a flight, but in theory, I think that I would still be able to, if something terrible were to happen, be able to fly back to America. I don't know that I would be able to get back into Germany, though. And my life is here, my work is here, my income is here. I could telecommute to a point. I don't think they'll let me work from another country for a year and a half. And as a consequence, I feel trapped in Europe. a bit. So that, and so if something were to happen to someone in my family, like just knowing that I couldn't go back to see them, knowing that, if somebody died, I couldn't go back, that's been very stressful. And so even though none of those things have happened, um, that's been a new world, a new reality. It's much more difficult for me to kind of process those things than self-isolation. I did a postdoctoral fellowship where I had to travel like down to London to sit in my office. So I just did a lot of work from my home. I'm quite used to being on my own in that way, so that's not such a big deal, but it's more from an expat perspective. It didn't even occur to me to not stay in Germany. This is where my life is, but there's still a stress. And I'm in constant contact, with my family, so I'm keeping up with them, and nobody is sick, but I think it's more just background noise. And that being said, I am kind of resigned to the fact that this could be the next 8 to 12 weeks of my life. Very possibly. And I am so privileged. I mean, I know this. I totally, this is why I'm trying to participate in the economy a little bit, because I recognize that I'm in a very unique situation so far. Who knows where I'm going to be in 3 or 4 months' time, because we'll never know. But I'm, for all intents and purposes, like a civil servant for where I work. I've also been with my employer for going on 10 years now. Was it 2011? Yeah, so next year will be my 10-year anniversary at my employer. So in terms of like being endangered of being laid off, one, I don't see that happening in the foreseeable future, just because our funding is preset. So we're not a company that relies on next month's profits to fund our operations. We get chunks of money that we get in blocks for like a 5-year period, and then we have to renew it. So there's no immediate danger of me losing my job. Also, I comfort myself to think, yeah, anxiety hits when in lockdown, definitely. Even if I were to be let go, being a German civil servant means I would get a pretty good package, like a landing package. And that's way far off, but I think just contractually they'd still be obligated to do some sort of, package where I would leave. So, and I would have plenty of time to like work out my situation. So none of that. I don't have work anxiety, and that even though I have the anxiety of separation, my separation anxiety from the States, that's really minimal. I mean, psychologically, it's a burden for me, but I don't have to worry about where my next paycheck is coming from, or I don't have to worry about getting a phone call that my job is being lost. And that's all right. After the public health concerns of what we have to do, that's the next thing, is like looking ahead to how do we minimize, how do we recoup, how do we make whole the people who, through no fault of their own, were made redundant or unemployed or laid off because of this crisis. And it's kind of so I don't know, for people in America who might be watching this, or people who haven't gone on the lockdown yet. On the one hand, it's very different. On the other hand, it's almost terrifying how quickly people can adapt. So we went from normal life 10 days ago, it feels like. Yeah, I think I started my home office last week, Thursday or Friday. So 10 days ago would have been like the Wednesday, when everything was open, everything was running. Now shops are, have security guards at them, and they'll only let through so many people at a time in order to allow for at least a, 6-foot distance between customers. There's, I went to the grocery store down the road from me, and not only do they have the tape, like they have tape where you're meant to line up, to keep a space between each customer, but they have a hanging sneeze guard in front of the cashiers as well. And again, I'm pretty lucky because I telecommute, and I have a history of telecommuting and working from home. So this isn't strange for me, and I don't have kids to babysit or pets to deal with. So my life has been completely disrupted, but on the other hand, I'm completely adapted. Make of that what you will. And I feel in a lot of ways that I'm so fortunate to live in a country that is run by a woman scientist, because Merkel is not doing the Johnson thing and she didn't do the Trump thing. And the others, so there's the source of my anxiety in terms of my life, my situation, not so much employment, but just what if I can't get home? What if, or the other thing too, like if I got sick, nobody from my family could come and visit me either. So that's it goes both ways. It's not just people back home, but also the isolation from having anyone come to here to help me if I ended up hospitalized, which is a very remote possibility. But I'm very, very concerned about the continued mismanagement of the crisis in America and the UK, mostly because that's where most of the people I know are from. So I've got a little bit of a bias, but I have a lot of friends in the UK and obviously family back in the States, and it's absolutely terrifying to see the lack of seriousness with which people are still taking it. It's always easier to say that once it's landed on your doorstep, right? And if we think about, the psychology of this isn't that different from your average human being. Most people live kind of in a form of denial about, something. Some people are very healthy, for instance, but a lot of people smoke knowing that there are risks. A lot of people drink too much knowing there are risks. And then when something really bad happens, they're still massively shocked. And that is, I kind of feel that the states still haven't quite gotten their minds around how serious this is, how contagious this is. And that's a function of what the president has led on and Johnson. The UK, to me, it's amazing to me that they still haven't gone on a complete national lockdown. Like, they are a week behind. I'm sure that there was some levels of panic buying here last week when we started instituting restrictions on work and movement and travel. But now that we kind of got through that initial everyone going, psychological panic of the unknown and very, very deep-seated instincts to make sure our food supplies are set, I'm going to put my hands up. When I went out and I bought food, I felt a little bit better. I wasn't hoarding food. I don't have enough space in my apartment to hoard anything. But just the going out and buying pasta or rice, tinned foods that would last for a year and a half. Just knowing that those were in my cupboard, it gave me a sense of relief on almost like a biological level. The other thing I've been doing with my nervous energy is cleaning my house. So there's a whole lot of nesting instincts that have kicked in here. We did that, now about 10 days ago, I guess, more than a week ago. And the UK is still just getting up and running. And I'm absolutely terrified for the time. The fact is that what really gets the most dangerous thing about this virus is its spread. The more it spreads, the more opportunity it has to find someone or to be transmitted to someone who is not going to make it. And that's, to me, this whole thing is, I think, changing our views of public health and pandemics and understanding exponential growth. A lot of us are on a very steep learning curve, understanding these things. And we haven't had to do this before. It's we haven't lived through something on the scale. We've had Ebola, and it was very dangerous, but we were able to contain it. We had H1N1, but again, it wasn't overwhelming our health system. And this virus has, this ability of, it's highly contagious. It can be spread even when people are asymptomatic. One of the other kind of scary things about it is that COVID-19 seems to have this, it's got a very nasty way of psyching you out. So you get exposed, for some people, they get exposed to it. It sits inside them and multiplies for a couple days before they get symptoms. They get initial symptoms of a fever, cold, cough. I guess dry cough is the real sort of tip off in combination with other things. And then you might have a couple days where you feel crappy. Then you start to feel better. Like you might have a day or two where you think you're rallying. And then it comes back and just hits you, kicks you in the butt, and then sends you into the hospital. So it lingers. It gives you all this opportunity to spread it around, especially if you've been sick for 3 or 4 days. Just think about that. And then you start to feel better. You're like, oh, I'm getting over it. So maybe I'll go talk to people, and I think I'm getting on the other side of this. Really what it's doing is it's kind of building up whatever for a second wave that, and that next wave is going to land you in the hospital. And that's when you're going to end up on the ventilator, and that's when you may end up dying. So the amount of time that the disease lingers in a person and allows it to be itself to be spread is something that we've thought about and heard about, but we've never faced before. We haven't had the full-on Black Death times. Yeah, I mean, and one thing that I guess we can be grateful for is, as lethal as this has been in terms of its mortality rate relative to the flu, it isn't wiping out entire cities. It's not wiping out entire communities. It isn't the Black Death. Although, if it was like that, I don't think it would be easier in some ways to contain if it was that kind of lethality, because part of the reason why it's spreading is that people aren't taking it seriously. People are going on spring break. People are still going out and meeting with their friends. And because a lot of people think, 80% of us are going to have mild symptoms if we get it. If it was the case that we're going to see our, with the bubonic plague, like our glands and stuff turn black and explode and stuff, yeah, people would stay in their house. But we don't have that kind of visceral reaction to the sort of flu, and so people haven't been taking it as seriously. Let's look at some really depressing numbers. I'm not going to be too long in the show because I've actually been asked to help out. I did some work on it this morning. I'm doing a little doodly video. But I've got some friends who are doing some sort of hackathon, and they're creating an app or a website that has to do with, let's see. They want to do a video on like helping students who are stuck indoors during Corona. There's a language learning platform that they're working on, and they want me to do a doodly video for it. So I've been working on that, volunteering my time this morning, and I'll be working on that this afternoon. So probably be a short show. Let's say, so JMM, I'm just going to read the chat a little bit, see what you guys have to say. I'm also going to blow it up a bit. It's kind of tiny in the window. Isn't our job to chat is distract you and keep morale up? Yes, it is, Sib. Thank you. Minimal pay leave here in the UK. Also, phone for signing on the dole. Yes, we're going to have to just dump a bunch of money into the economy. And governments, traditionally not very pro-worker governments are seeing now that you can't just have 20% unemployment and think that you're going to get through this. So I have a feeling that we're going to continue to see governments throw money at this problem. What the long-term economic impacts of that are, I don't think we can even worry about right now, because we have to, again, if your house is on fire, the first thing you do is you get everybody out. And that's what we're kind of doing right now, is we're trying to get everybody out of a house that is burning down. And once people are, getting out of the house, then we can worry about where to put out the fire and how to build new housing. But first things first. So we're still in the early stages of this. If I were to hoard food, I would store it in my belly. I already have packets of noodle diet before the pandemic. And look at how awesome Japan is doing. Yeah, you can tell that there are countries with high degrees of social conformity and are doing better. Countries where the government has a serious amount of power, or there is a social norm of compliance. I think we do have to look at the psychology of this. Part of the reason China didn't have as many cases as they could have is because they did have the authoritarian power to just shut down the center of it. Right? Wuhan, right, is the area where it was centered, but it hasn't spread across China the way it has spread across the United States. because we have freedom of movement, and our government just didn't respond. Our federal government still isn't responding. So there are some really terrifying statistics that if you want to be depressed, this is what you look at these days. So this was updated on the 21st. So that's today, right? I think it was just updated. Oh no, it was yesterday. So this was updated yesterday. You can see here that the way that the FT is running this is they are trying to make a metric to compare like with like, because it's going to be, if you have a time difference, you have to find a way of making times conform and, like similar. So the way they do this here is this is the number of deaths after the 10th death. So once a country hits 10 deaths due to that they attribute to coronavirus or complications thereof, they start there on the 0. And then this way we can see how all the countries are in a more comparative way. And as you can see, where they took really severe action in China, they were able to really bend that curve and keep it to under 3,000 deaths. They paid a massive social price for that in terms of lockdowns, factories shutting down, drones flying around, encouraging people to get back into their houses and things. But they were able to really pull this curve. The Iran data, honestly, I don't believe any of this. I don't think that Iran is putting out accurate numbers. I think there's a government incentive to misreport or underreport. So although we're working with Iranian data here, I would put a question mark by that. You can see here that Japan and South Korea both just really bend that curve downwards a lot. So you have, again, very different kind of cultural norms in East Asian countries, South Korea, Japan. I think we're also going to, look at places like Singapore at some point in the future. That might be the same in an authoritarian country like China. And in Western countries, it's a much steeper curve. One government's, in China, they can build a hospital. They have the sort of focus and resources and will to just impose, they have that power. I'm not saying it's a good thing. I'm just making the observation. They can build a hospital in so many days. New York has to get Donald Trump to get the Army Corps of Engineers, and Donald Trump is off on a PR marketing focus. He's not on a problem solution focus. So just the amount of freedoms we have also can mean inefficiencies. I'm not saying we should trade our freedoms, but in this case, it will be an explanatory factor as to why we see more deaths in the West than we have reported. And again, China too, I don't think they're being 100% transparent with their data. So you can see here, these trajectories are pretty scary. Spain did its lockdown, like maybe 6 or 7 days after its 10th death. And it's still on a super high trajectory relative to the other countries. Italy is starting to bend the curve away from this sort of 33% daily increase. They had over 700 deaths in Italy yesterday, 400 the day before, 400 the day before that. That is what we are going to see. But I think given the lack of containment in the US and in the UK, I think they're both going to outstrip Italy as a proportion, like is in terms of a ratio. Just my estimates, right? The UK here too is on a pretty high trajectory. Much right now, it's outpacing Italy in terms of where its curve is going. So if we extrapolate this out, you can see here that if Italy kind of goes in this direction, this chart only goes up to 5,000 deaths. Italy is arcing, and it depends on how much they pull that curve, but they are definitely on track to hit more than 5,000 deaths. At this rate too, Spain is not flattening that curve. Look at the trajectory there, right? And the US, this is a little bit wonky here. We have lack of testing. There might be deaths that are classified as pneumonia that are not properly classified as coronavirus because of a lack of testing. However, given the rapid spread across the states and the slowness of state-by-state responses because of an inadequate and mismanaged and incompetent federal coordinated response, I don't expect the U.S. numbers to start bending anytime soon. We have to wait about 10 days to 2 weeks before we will be where Italy is right now. So you compare where the U.S. is. I think they're at, did they clear 300 deaths? We'll have to check. Spain here is more than 800 people have died in Italy before the lockdown, right? Germany we have down here. They're getting up close to 100 deaths, but as I said, there's some reasons why Germany is landing lower. So it's also interesting. Germany and Switzerland seem to be very close in terms of a cohort. I've been watching this for a couple of days now, and Germany and Switzerland borders on Italy, if I remember my European geography correctly. I might be wrong, but Switzerland and Germany have been pretty much in lockstep over the course of these days. So it seems like there's almost, in Europe, a two-step process. The French, Spanish, Italian arcs, and then the Switzerland and Germany arcs. And it's kind of hard to tell yet where those are because it's so low, but hopefully it's bending downwards. At this point, it's just time and math. The more time we have people moving around freely where they can potentially become in contact with it, or if they have it, spread it, the more fatalities we're going to see. But we're not going to see them. People who get sick now might not die for 5 weeks. So they're walking around with a death sentence. They just don't know it. So, as you can see now, these are not deaths, these are the cases. And the cases are a little more difficult, I think, to do a meaningful like-for-like comparison because of the way that testing is really skewed and biased. So by that I mean, in a country like Germany, where they did have adequate testing, they were able, and in places like South Korea, and Singapore and Japan, where they put a lot of effort into testing, they will catch a lot of cases, and including a lot more of those cases that aren't going to end up in any kind of hospitalization. Whereas in the U.S. now, I think in New York State, I saw that testing was being limited to people who were already in the hospital, people who are healthcare workers, who were vulnerable to being exposed and needed to have checks to make sure that they weren't infecting patients. And then I think some at-risk groups. So because you're limiting the kinds of people that are getting tests, you're limiting them to people who could potentially get the disease and die from it. So it will skew the ratio of tests results to mortality rates. So that would be my caveat here in terms of the way that it's going, because we can't compare like what South Korea did with their 10,000 tests a day to what the United States did, because we just didn't do that kind of testing. But now that the U.S. is picking up on its testing, we're going to see we're already close to where China has. China did have the ability to do travel restrictions. We just didn't. And the Americans have just spread that freaking everywhere. And the other thing too is this: I wish they would log this in a little ways, because you can't really compare like for like Spain and the United States because of the number of people. So at some point they're going to have to adjust this so that it looks a little bit. It doesn't give kind of the weird impression like we're going to pass Spain here in terms of the number of cases, but of course we would because our population is so much bigger. But interestingly enough, here again, we've got a sort of a cluster of countries: Belgium, Norway, Sweden. Down here, they're a little bit lower now. We'll see what happens over time. The Netherlands, Austria, India. That's a number that scares me. I'm worried about what potentially could be happening in India, and you can see that here the trajectory of their curve looks like it could go high, very high. And the UK was not sufficiently testing, so I don't really believe these numbers in terms of like the number of cases based on the number of tests, because they just didn't test. They weren't widely testing in the UK. They also, here on the FT, look at a bunch of other countries as well that aren't in that chart and kind of compare them to where they are on the trajectory. So Ireland, for instance, seems to be sort of middle of the pack. Israel as well. Finland started out with a bit of a spike, but seems to be curving it. Estonia as well. Ecuador, however, that's pretty high on the arc. And I think it makes a lot of sense that there was probably going to be a correlation between gross domestic product and the spread of the disease. Probably, Turkey looking very bad. So all we can do right now is look at the data as it comes in and try to use that to extrapolate to know where we might end up in the future. But these are scary times, absolutely. And I don't know if we have time. A lot of newspapers, by the way, are putting all of their corona-related information outside of a paywall or outside a firewall, paywall. Therefore, you can read about it, and I would definitely encourage you to spend time consuming media on this and consuming experts who are talking about this. And I've seen polls now where both Trump and Boris Johnson saw increases in their approval rating or were given positive ratings in terms of how they are handling the virus and the crisis. There's kind of two ways we can explain this, I think. One is, we know in political science that there's an effect that we call rally around the flag. When there is a national emergency or a national disaster, you can think of 9/11 for Americans. When that happens, there tends to be a sense of kind of coming together as a country and coming together and this isn't just Americans, this is a phenomenon we find in a lot of countries. And people will give an artificial boost of support to the leader as a way to kind of demonstrate national unity. Rally around the flag effect. We've seen parts of that, like that, and we think that that's happening a little bit right now with the crisis, where people find it's sort of unpatriotic to criticize someone who's leading during a crisis. Give it time, because people will sour very quickly when things start to go very bad. And in the United States, we're not prepared at all, either with equipment or beds or even a plan of how to handle all this. They are still making this up as they go. And Johnson's government decided to, I don't know what idiots they had in this medical team that they were consulting, but apparently there was, despite all of the evidence of their eyes, they really thought, and maybe it was a self-delusion of British exceptionalism, thinking that you couldn't get people to go on lockdown, thinking that people wouldn't accept restrictions on their lives. And I know that for a couple days, Governor Cuomo in New York has been saying, we're not going to do a total lockdown because New Yorkers won't do it and they'll be resentful. And increasingly, they're moving more and more to lockdown because they just have to. The numbers are such that, as he said, if you think about the number of people who get coronavirus, who then become so sick that they need hospitalization, as the exposure rate goes up, the number of cases goes up. So if you think about it like a hose, there's more pressure, right? So the way that you turn the valve down is you get people to self-isolate. So you turn the valve down a bit, you get some isolation, you see if that helps slow down the wave, the pressure of cases that are filling up. And if that doesn't do it, you turn the valve again and you do more restrictions in order to get people farther and farther away from each other. And if that doesn't work, if that won't ease off the curve, then you turn the valve off. And that's where we are now in terms of just staying in our house. We're turning the valve off and we know it's inevitable that people will get coronavirus. not trying to stop it from spreading, trying to stop it from spreading faster. So my best case scenario is if I'm an unhealthy person with underlying health problems, if I'm going to be, if it's genetically or in my lifetime destined that I get coronavirus and it was going to kill me, what I really want is to delay it, my exposure, inevitable exposure, for like 6 weeks. So that the current crop of people can get out of the hospital and then I can get like the care I need to stop me from dying. And turning these valves, social isolation, is the only way that we can try to, as you say, flatten the curve, try to get that line, instead of it being a crushing line in front of the hospital, just adding people slowly, a continuous line, but adding them more slowly. They had, so the British government was going on this stiff upper lip. We're going to, just let our health system deal with it. And God, they were just letting people run around London. They were just letting people come back and forth from the hot spots. I mean, Italy obviously shut itself down, but people who are coming through, international travel. When Trump shut down European travel to the United States, a lot of people went to London and Heathrow in order to get a connecting flight out of London to get to North America. Pubs were open. Gyms were open. I don't know if you've ever had an opportunity to use the underground. The underground, it's packed. If you cough and this virus stays in the air for, up to 3 hours, you've got a potential exposure of thousands of people. And then they each, so I'm very, very, very scared for what London is going to look like. You think New York looks bad now? London in 2 weeks' time, I have high anxiety for this. So we'll look at this a little bit. I'm sorry, guys, to bum you out. I really wish I had some escapism for you, but I think right now I just need to process this too, and you guys are helping me process it. Before I read the article, why don't I just check the chat very quickly? Let's see if you guys are snarking or whatever else. It was experts. It was the experts were divided, and there was mismanagement. Ultimately, Boris Johnson is responsible for the policies because he's the prime minister. He relies on advisors, and in this case, it looked like his advisors were not doing their jobs. I mean, there was some people who were advocating for a more stringent lockdown thing. There were other people who weren't, and because of the lack of consensus on which direction to go to, they kind of hedged their bets and didn't do enough fast enough. And I'm really super terrified that the NHS is going to crash. All right. So an Imperial College coronavirus model has had a profound impact on public policy since its results were shared with British and American officials last week. No study has so exhaustively detailed the transmission of the virus through the UK and US population, the overwhelming pressure it has placed on health systems, or the limited effectiveness of individual measures to check its progress. And can I just emphasize here how incompetent and unprepared we were in America? We have health staff now who are needing to take time off sick because they've been exposed to coronavirus. Trump wanted to compare this to a war, and he wanted to compare himself to a wartime presidency. What he did was he sent our soldiers into battle without protective equipment, without the tools they needed to fight the war, completely exposed, and as cannon fodder. He's completely incompetent. If you want to do this on a war footing, it's like sending out your soldiers and asking them to just pick up the weapons of their fallen comrades because we don't have enough guns or helmets or protective vests or anything for you. So just make do with what you have. People keep saying that America has the best. Not people. Okay, people on the right. America has the best healthcare system in the world, and yet we're needing grandmothers and aunts, and I don't want to gender it, and people and men too, who are making face masks, who are volunteering their time to make face masks because the federal government is been so incompetent. A lot of these myths about the American exceptionalism and how great we have it are being exploded because of this pandemic. All right. So I just want to put that in there because I don't know that these assumptions included the reduction in health services because staff were infected. So when we run these numbers, I don't know that you take those kinds of, how do you even model that? How do you model losing maybe upwards of 10 to 20% of your healthcare workforce because they will either be exposed to the disease and have to be taken off of work for 2 weeks, or they could die. And there are health professionals already who have died because they are treating patients. And also they want to call up a bunch of retired nurses and healthcare professionals to help, which is great, but that's also the most at-risk population. So if you don't have the proper equipment for them already, and how are you going to make sure that the people you're bringing out of retirement, you're not asking them to go basically into a war zone and sacrifice their lives, which a lot of them will do, but shouldn't you be a bit more prepared than that? Okay, sorry, I'll focus on the article. Like any simulation, it rests on uncertain assumptions. Many factors remain unknown to the research team. But even with this caveat, the conclusions are brutally stark. Democratic politicians face only terrible choices in the battle to save lives. The starting point for analysis is an unchecked epidemic. That would infect 8 out of 10 people, according to researchers, with 500,000 deaths in the UK. And the US death toll here, without any controls or spontaneous changes in behavior, worst case scenario, 2.2 million Americans. 500,000 of people in the UK. And again, I don't think that these models include appropriately for the stresses on the healthcare system that will force more doctors to make life and death choices because of lack of resources. But maybe I'm just overly pessimistic. While the estimates draw on hospitalization rates in Italy, it assumes every patient receives adequate care. If there's not enough ventilators, that assumption can't be met. In practice, the researchers find available beds for critical patients would actually be exceeded by the second week of April. At peak, for every 30 patients requiring critical care, just one could be treated adequately. The mortality peak would occur after about 3 months. Because of its geographic size and younger population, the US lags the UK in how rapidly the virus spreads and the death rate it causes. Well, again, just to take it into consideration, I don't know how you model the spring break spread of the virus. The Florida on the beach spread. But again, we're doing what we can. Analysts are doing what they can. While a vaccine is developed, a process that can take 18 months, the US-UK governments are left with 2 extraordinary choices. The first is mitigation, reduce the peak of infection while the population builds immunity. The second, a more drastic suppression approach to quell the epidemic, whatever the cost to the economy or trauma for social life. That's obviously what we're having to do. And this is why. Peak demand for UK critical care beds will far outstrip supply even under the most ambitious mitigation strategies. We're seeing in Italy where doctors have patients come in and they are looking at an elderly person, 75, who needs a ventilator, a middle-aged person, 46, who needs a ventilator. And the doctors are having to say, I have to pick the person with a better chance of living, not only because they're younger, but they have more years ahead of them. So they're having to prioritize. They're making life or death choices. And this is obviously incredibly bad if you're elderly, because if you're in your 70s and you have underlying health conditions and the doctor is put in that situation, which is what doctors in Italy are being forced to do every day, that's only going to extend as these weeks go by based on pure maths. I hope it's not the case, but it occurred to me last night that I feel a little bit like, the story of Moses in the Bible, where the plagues are going over Egypt, and the final plague is the death of the firstborn, because God, the God of the Hebrews is so compassionate that just going to randomly kill firstborn people and firstborn children. But you put the blood over the door. You put the lamb's blood in order to be passed over, hence Passover. Sitting in my house now with the door shut, I'm hoping to be passed over. That's exactly what it feels like. So when it comes then in terms of the ICU hospital beds, I know that they've just contracted, I saw in the news, for an extra 8,000 beds. Drop in the bucket. Drop in the absolute bucket. So this is peak demand for UK critical beds will far outstrip supplies even under the most ambitious mitigation strategies. With household quarantine for cases, schools, university closures, they're looking at over 40,000, right? What is this estimate number of maximum beds in? Yeah, thousands. So here's 0,000, 20,000, 40,000, 60,000. Everything is just pointing at the NHS being overwhelmed. So the most effective missed test involved asking people to stay home for a week if they show symptoms, quarantining their household, and urging over 70s to keep a distance. This would reduce demand for critical beds by 2/3 and halve the number of deaths during the 3-month period. They're still not quite to that point yet, I don't think, in the UK, or they are just getting to it now. But crucially, demands for critical beds would still outstrip capacity 8 times over in both the United States and the UK. The Imperial researchers describe it as perhaps our most significant conclusion. Governments are racing to expand critical care, yet even assuming all patients could be treated, the Imperial researchers conclude mitigation strategies alone would leave about 250,000 dead in the UK and around 1.2 million in America. This is it's probably going to come back. This is our test run. This is our beta run for what we might have to face in the autumn, because what we saw with previous waves of such infections was, I think actually the Spanish flu followed a very similar curve where it came up in the spring and then went away in the summer, and then was sort of in the population but just in smaller levels. And then when this flu season, cold season started, it shot right back up again. So we'll probably see whatever we might be reliving with travel restrictions and other things in a few months' time. I wish I had more positive stuff to talk about, but I think it would seem frivolous. As I said, I don't feel this is the right time to spend an hour complaining about Bernie Sanders. I'm not enough into the economics or an economist to talk about that. I can talk a little bit about stats and numbers and just kind of translate from this into maybe more plain speak. But what are you guys in the chats saying? Yeah, we didn't have enough beds over the winter. There was a media story of a boy who had to stay on a bed of coats on the floor. Yes, and that's the other thing, postcode lottery in the UK. Not every place has enough resources. So there's that problem too. I'm really, maybe next week I will try to do something a bit more frivolous. At this point, though, I think I should just kind of wrap it up. I'm going to be doing home office now. I'm stuck indoors. Kevin is self-quarantining because he had a potential exposure at his workplace. We're probably going to be doing more happy hours, so you'll see a lot of me in the next week. I think I'm going to wrap up the Sunday show, though. I want to go and work on the volunteer work I'm doing to help kids who are struggling or are bored right now, try to promote this app for them. And it honestly is also just depressing to talk about this stuff. So for my own mental health now, after an hour of processing the fact that this is our lives now, this room, my flat, my view is mostly my life until maybe April, maybe May, maybe June, who knows. But anyway, guys, whatever your situation is, where you are, I hope you're healthy. I hope you're staying safe. Please stay indoors. Please don't, even if you don't have self-isolation or any of those things going on where you are now, get ahead of the curve. If your state hasn't started cracking down on stuff, do it yourself. I've talked to, COG is in the UK, and I was in messaging him, last week, like, stock up on stuff. This is coming your way. The UK government is behind. You guys are going to have to do this anyway. I know they had a big discussion with their family about elderly people, a lot of us are having these kinds of discussions and setting up support systems. So, your grandparents or your elderly parents don't have to go outdoors, and you can set up some sort of system of food delivery, checking in on them, setting up communication systems now before it all hits. And yeah, get you on Steam with tabletops so I can unwind with board games. Oh, yeah. Oh, speaking of which, I haven't set it up yet, but I was thinking about trying out that Netflix party. I just been, kind of distracted doing other things, so I'll promote it tomorrow, I guess. I'm just kind of like low energy. Maybe I'll do it later on tonight, but probably tomorrow, if I'm honest. Yeah, and cabin fever. This is the stuff I do to help me not have cabin fever. So, hanging out with you guys, chatting with Kevin. The world doesn't feel quite so far away. Yeah, so I'm sorry that this was a really downer show. Sorry that I couldn't be more up and have more positive news. I will do what I can to use my stats background to try to translate some of this. I will defer to the experts, though. I'm not an epidemiologist. I don't do massive, large-scale stuff, but to the extent that I can try to bring these charts in and translate them, I will. Yeah, so you guys stay entertained, stay away from everybody. Yeah, and speaking of that, I'll give you a hug. Bring it in. Oh, there we go. That's my only social contact now, probably for a week. I have 2 people I know that I can hug, and I have seen each of them this week, and now I don't know if I'm going to even, when I'll have a chance to maybe next week sometime see them again. So that's the closest I'm going to get to a hug. So thanks, you guys. Till next time. I've been Christy. You have been awesome. Thank you for your time and attention. Thank you for stopping by. I'll see you on a happy hour, or maybe I'll see you at the Netflix party. I will explain how to do that in a video tomorrow that I'll put up on my channel. So, yeah, that's about all I have to say. Stay safe, stay healthy, and see you next time. All right, now I just have to do the end stream button. And there it is.